we're talking about with the low heart rate. I find that so interesting.
Mhm.
What, why? Do you know why there'd be a relationship between people with methane and lower heart rate?
Well, so you know what we used to use to put people to sleep to do surgery? Carbon tetrachloride. You know what carbon tetrachloride is? A carbon with 4 chlorine molecules around it. We have a molecule called methane, which is a carbon with 4 hydrogens around it. So it's just a substituted hydrocarbon, carbon tetrachloride. Now, we don't use carbon tetrachloride anymore. We use isoflurane, which is still a substituted carbon molecule. And these gases, these anesthetic gases, affect you. They affect your blood pressure. They affect your pulse rate when you're under anesthesia. And methane has, I don't want to say anesthetic effects, but it has groggy effects because it's similar to all these anesthetic gases. It's like the canary in the coal mine. When the methane goes up, the canary falls asleep. So, and then there's too much methane in the coal mine. So that's maybe why patients get brain fog and with methane, and we just need to understand the methane effects more. But yeah, lower heart rate, interesting. It's fascinating.
So it'd be easy to extrapolate that that could lead to fatigue, right? That kind of feeling of lethargy.
Well, if it blocks your heart rate or blocks the heart rate from going up appropriately or slows the response, so maybe you can't exercise as vigorously because you can't get that response in heart rate. We're guessing here. We're just
I know, right?
shooting
Totally
shooting
guessing,
the breeze.
people.
We're
Totally
shooting the
guessing.
breeze because we
Yep.
don't have data
Yeah.
yet. But
Chatting.
there are a lot of potential implications of a lower heart rate and what that means. But when I say it's lower, we're talking about 3 beats per minute lower. So we're
Right.
not talking
Right.
about 20. We're talking about 3 beats per minute. But over a lifetime, that's a lot of beats, and so
Sure.
that's all.